Patient Engagement in Clinical Development Service has been designed to bring patients and life science companies together earlier in the clinical development process, so that patients can help companies make trial designs as patient-friendly as possible, helping to increase recruitment and retention into clinical trials. In the next few minutes, this video will explain exactly how the service works. To get started, you must register your interest using an online form, which can be found on our website at www.nihr.ac.uk/PECD. On the form, you will be asked to tell us about yourself and the company you work for, the study you are seeking feedback on, including the therapeutic area you are interested in, the aims of the study, what stage the study is at in the research lifecycle, anticipated patient numbers needed for the study, and the patient eligibility criteria. You will also need to provide an overview of what you want to achieve from liaising with patient groups and how you would like to work with them. For example, this may include organising an insight session, asking patients to review patient information sheets, asking for feedback on trial design, or obtaining advice on the timescale of the study, to name a few. Once the form is submitted, we'll review it to ensure each request is both possible and appealing to patients. If there are any outstanding queries, or areas we feel that we could work with you to improve, we will reach out to you to seek an efficient resolution. The information you provide in the form will be restricted to approved members of our staff. However, we will also need to share study information with appropriate patient groups to promote engagement and deliver the service. This is clearly stated in the online form. Once your request has been approved, we will use our resources and connections with clinical researchers, patient groups, patient ambassadors, individual patients, and the wider public to source relevant patients for your study. This can take a few days, but don't worry, you will receive regular progress updates from your allocated NIHR facilitator. Once suitable patient candidates have been identified and we are ready to proceed, a letter of agreement will be generated to confirm the engagement activities and clarify what will be delivered. Your NIHR facilitator will then liaise with the patient participants to coordinate your chosen form of engagement. This may include support such as arranging a suitable venue for an insight session, coordinating travel plans, organising the setup of payment for participation, as per involves national guidelines for payments to patients. Your facilitator will also be present on the day to ensure everything runs as smoothly as possible. They can also provide support prior to the event by co-authoring patient-facing materials to be used during the session. It's free to register for the service, but a full cost recovery model is used to reimburse costs of patient time, patient expenses, and NIHR facilitation time. Upon successful completion of the service, the final cost will be calculated and an invoice generated in 30 days. If you are interested in using the Patient Engagement in Clinical Development Service or have any questions, the registration form and supporting documents can be found at www.nihr.ac.uk/PECD.